So you've mentioned helpful thoughts, you've mentioned hindering thoughts. I am interested to know how that might apply to someone who can't give up smoking. So say I have a friend and they're finding it really hard to stop smoking. What is it that he needs to do, maybe with his thoughts, in order to try to give it up?
Try is another really good word we use all the time,
Yeah.
all right? Because often the word try doesn't really allow us to make full commitment to what we want to do.
Yeah,
okay,
true,
but
true.
everybody uses it.
Yeah.
Okay, and it's just another word that then feeds into our thought process.
Yeah.
So by just using the word try, the thoughts in your head are already saying, how committed am I?
Yeah, yeah.
Okay, so I suppose the first question that I'd have for this person giving up smoking is he aware he has a problem, and does he want to give up?
So I'm not too sure how, if just in this scenario, I would say I'm not too sure how much he would like to give up.
Okay, and that's a common situation that we come across, and it's really important to become more aware of what stage is this person at in terms of wanting to give up.
Yeah.
And I'd like to just introduce a model of change that helps us to understand how somebody can make change happen in their lives. And this especially works for behavioural change like stopping smoking or stopping drinking. And there's 6 components to this change cycle.
Yep.
And you can write these down, Fatima. So I'll just tell you the stages first, and then we can just say a little bit about each of these stages, if that's okay.
Yep.
So the first stage is pre-contemplation.
Okay. Yep.
What does that mean? Contemplation is thinking, so before you're thinking.
Yeah.
All right. So pre-contemplation. That leads to contemplation,
Yep.
which is thinking. Okay, becoming more aware of your thoughts. Contemplation then leads to the next stage, which is preparation.
Yep.
Okay, preparation then leads to action. Action then leads to maintenance.
Yep.
And the last stage, maintenance, can lead to relapse. And relapse goes back to join up with pre-contemplation.
Okay.
So in terms of this person who wants to give up smoking, when they're at the pre-contemplation stage, at this point, the person smoking may be unaware that they have a problem. Or put another way, they're in denial.
Yep.
They may have very little intention to change their behaviour. Hopefully, with the right kind of support, you go from pre-contemplation to contemplation. Here, at the contemplation stage, the person has become aware they have a problem, but they're still not committed to doing something about it. And this stage is recognised by ambivalence or conflicting emotions. I want to stop, I don't want to stop. I want to stop, I don't want to stop. The contemplation stage then goes to preparation, which is the person with awareness that they've got a problem has now got some intent on taking action to correct their problem. At this stage, the person is often out to get more information. They might want to talk to somebody who's given up smoking. They might read books about what smoking might do to their health. And in addition, the person at the preparation stage has to have an element of motivation and self-belief that whatever they're going to do after this stage, they've got enough strength to carry it out. You then go to the action stage, which is the person is now ready to take some concrete action to stop smoking. They might decide, for example, now to book an appointment with their doctor and look at the options available to actually stop smoking. And again, a really big step to think about that, to book the appointment and then turn up to the appointment, all part of the action stage.
Yeah.
And after seeing their doctor, the doctor might prescribe nicotine patches, the person starts to use their nicotine patches and then becomes a non-smoker. They're in the maintenance stage. And the maintenance stage, essentially, they're remaining off the smoking for a period of time.
So you've talked about all of the individual stages. How do you go about helping someone move from one stage to another?
So that's a really important question. The first thing to note is that thinking happens at each of the stages that we've just described in this cycle. And the thinking helps the individual to build more awareness that the person should take greater responsibility and ownership of the problem or issue that they have. To support a person move from one stage to another, we make sure that the support we offer is geared to the particular stage the person is at. So step 1 is identifying what stage is the person at. Step 2 is then what support we offer. So what do I mean by that? If somebody is smoking 60 cigarettes a day and doesn't believe they have a problem and doesn't want to give up, there is little use telling them to see their doctor for nicotine patches. What we can do is to support the person towards better thinking and raise their awareness from, I don't have a problem, to, I might have a problem. And you do this by asking really good questions. Good questions are a great way to improve people's thinking. The individual might then start to reflect on their problems in a different way, or reflect on the risks their behaviour is having on their own and other people's lives. For example, what do they get by smoking? What are the risks of smoking to themselves and to other people? Once they're at the contemplation stage, they recognise they have a problem and they want to do something about it. At this stage, you might want them to get them to look at the pros and cons of their behaviour and weigh up what is happening in a little more detail, or help them identify any particular barriers that they may have to changing their behaviour. Once they're at their preparation stage, they can get further information. For example, might want to go and see their doctor for help. Their doctor might then, asking some really good questions, help them to pick the right kind of action that they want to take to actually get to a better place in terms of coming off their smoking.
Yeah.
And that can involve things like, for example, the doctor might actually show them pictures of the insides of their bodies, what happens when nicotine clogs up the lungs. They may have a video that they can watch on somebody who's actually not breathing well because they've actually damaged their lungs so much. Once you get to the preparation stage, the action stage, the maintenance stage, really, really important that people begin to celebrate success. And whatever change has happened in a good way, people need to acknowledge that and not just kind of take it for granted. So celebrating success is a really important way of working through this cycle.
And I might be wrong, but you said there are 6 stages, and I think we have only covered 5.
That's really well picked up, Fatima. So the sixth stage is relapse. This is where the individual can fall back to their old pattern of behaviour. So relapse is identified by the person feeling disappointed, frustrated, or the person thinking that they've failed. If a person relapses, it's not all bad, because relapse allows an opportunity for the person to become more aware of their thinking and identify triggers for relapse, as well as how to better overcome barriers. So really important, the relapse stage does not necessarily go back to pre-contemplation.
Yeah.
But hopefully, once you relapse, you go back to preparation and very quickly to action. So you're missing out pre-contemplation, contemplation.
Yeah.
So the cycle gets shorter and quicker each time you go through it. And that is essentially evidence of better thinking.
So when you say we miss out pre-contemplation and contemplation, we don't contemplate at all?
You would still go through those stages, but you won't spend as long in those pre-contemplation and contemplation stages because you've gone through that and you've balanced up the pros and cons. You really you might challenge yourself. How long did I stay in the maintenance stage? I want to stay longer. How do I stay longer? So it just becomes a lot faster.
Yeah.
So that each time you go through the cycle gets quicker.
Yeah.
And I suppose somebody who relapses for a few days and then spends a whole year not smoking is not a bad thing.
Yeah.
So in a way, we can see this change process as a way of supporting someone's behaviour change by asking really good questions, challenging individuals' thinking about their motivation and responsibilities to change. In short, we're using a coaching approach to improve a person's awareness of their problem or issue that they want to change.
So you've mentioned the word coaching, and I kind of thought coaching only really applies to, athletes and people that do kind of sports at an Olympic level, not necessarily to us usual people.
That's really a great question, and lots of people think about coaching as linked to sports, and it's probably the kind of thing more people are aware of. So Andy Murray has a coach, and there are football coaches. But increasingly now, the word coaching is something that we're bringing into the NHS,
Right.
and we're helping all of our staff to think in a better way, not just about themselves, but about their patients, and how we can support patients make recovery in a different way. And it all goes back to becoming more aware of our thinking. And once we're more aware of our thinking, we can help somebody else's thinking to improve. So where do you think, Fatima, the word coaching comes from?
Honestly, the bus, the coach that takes you to places.
Okay, so that's really well picked up.
Yeah.
And it is a coach, stage coach, all right, is a four-wheeled vehicle used for transporting people from one place to another.
Yeah.
So whereas a stagecoach, or the coach that you have just described, physically takes people from one place to another, when we talk about coaching, whether it's sports coaching or whether it's coaching in the NHS, what we're saying is it's helping somebody's thinking to go from one place to another. And putting that in a common scenario just recently, people will associate with somebody who's not wanting to, for example, have the vaccine, right? The COVID vaccine. So that's where their thinking is at, which is absolutely fine.
Yeah.
But how do you help support someone's thinking from, I don't want the vaccine, to, this is something useful for me and for other people? That's a change in thinking. It's a change in mindset. So at the heart of supporting someone's thinking to change is the way we have conversations. And there's lots of different ways of having conversations. We're having a conversation now as we're talking, Fatima. But I just want to share with you one dimension of having a conversation, if that's okay, Fatima?
Yeah.
So in your mind, if you could draw a line, okay, just in your mind, draw a line. And on the left-hand side of that line, you can write the word tell, T-E-L-L.
Yep.
And we touched on this earlier. So one way of having a conversation is to tell people what to do. And it's a prevalent way of having conversations in our culture. Not just that, it's prevalent in the NHS. As a medical student, I was told what to do. As a junior doctor, I was told what to do. Even as a consultant, sometimes I'm told what to do.
Yeah.
But telling, do you think it helps when you tell somebody what to do?
No, we mentioned this before as well. It takes away someone's control or choice.
Absolutely. And it takes away choice. It takes away responsibility.
Yeah.
And if anything, the person who's doing the telling lays themselves open to blame.
Yeah.
Because the person who's doing what they're being told, why am I taking responsibility?
Yeah.
Okay.
Yeah.
So that's one way of having a conversation, tell people what to do. And in a disguised way, often in the NHS as well, doctors, other healthcare professionals, we often tell our patients, stop smoking.
Yeah.
Okay, stop doing this, it's bad for your health.
Yeah.
They may actually stop initially, but it doesn't really get them to change longer term because it's not come from them.
Yeah. That makes
So
sense.
that line in your mind's eye, on the other extreme, on the right-hand side now, okay, if I ask you to write the word or say the word ask, okay, ask a really good question. And when you ask a really good question, for example, this friend that wants to stop smoking, why do you want to stop smoking? What will you get by stopping smoking?
Yeah. Mm-hmm.
How much could you save by stopping smoking? What might you use the money that you save on? So all those questions, rather than tell that person to stop smoking, you actually ask them some really good questions. So really good quote about questions and what questions do. Questions wake people up. They prompt new ideas. A really good question shows a person new ways of doing things. So just to remind again then, so that's a continuum of a conversation, Fatima. Telling people what to do or asking them really good questions to allow them to think for themselves, because when they think for themselves, they're more likely to own their own thoughts. They're more likely to do because it's coming from themselves. It raises awareness in their own minds about the importance that is placed on their own thoughts and taking responsibility, ownership. But it is a continuum. So there is always a place to tell people what to do sometimes. So in an emergency situation, clinically, I will not ask a person a really good question. I'll say, do this, this and this, because the emergency requires that. But when I'm in, for example, a conversation later on outside the emergency situation, I might ask that person a really good question about how did that go?
Yep.
Could we have done things better? So whereas a physical coach takes you from one place to another, when we talk about coaching, it's about supporting people's thinking to improve. It can help support someone's mindset to improve. So when the government rolled out the vaccination, they should have really done a coaching approach, okay? Not just give figures of, this is really important, everyone must do this. What are the questions that they should have asked? It's priceless.
Yeah. No, I think that's really important. And then that's something interesting to think about now you've mentioned it. I'd also like to ask about, so you talked a little bit about the cultures that we were growing up in and a bit about NHS culture. I think especially it's interesting at the moment. There was recently a TV show called This Is Going to Hurt, and that, talked quite a bit about the culture in the NHS. And so is that something that's different now?
Again, really good question. In the 30 years in the NHS that I've been practicing medicine, definitely the last 5 years, there's been a real culture shift in terms of acknowledging that we can't just tell people what to do.
Yeah.
And the workforce has to take more responsibility and ownership, and people need to be given permission to think differently.
Yeah.
And we're seeing that happen in the NHS now. Bradford District Care Trust, where I work, we have quality improvement framework, methodology that we're doing really well with.
Yeah.
But part of that is linked to having a coaching approach across the whole organisation. And what this means is that we really want to encourage people to become more aware of their thinking and how that then impacts not just on their own, for example, health and well-being, but then the patients that we're actually working with in terms of improving their lives. And that's beginning to have real impact. Okay, once you have a workforce that is committed to improving things, not just for themselves, but for their patients, and becoming more aware of that, they're more likely to actually sustain that improvement in the longer run.
Mm-hmm.
And it also links in with where I work in Bradford. The take-up, for example, of psychological therapies and ethnic minorities. And talking therapies, often people from ethnic minorities often don't take up that opportunity as much. And it's, again, a mindset, people not aware of how useful some of these ways of helping them could be. And how can we actually support that to happen better in the future?
So I have no more questions left for you, but I'd just like to ask, would you be able to give a overall kind of summary and a few final points before we end today's podcast?
So if I could share something that Henry Ford do you know the famous car maker said? Ford cars.
Oh, yes. Yeah, I was thinking, I don't know who Henry Ford is, but Ford, of course.
Right.
Yes.
Right, the car maker.
Yeah.
Right. So what he said was, thinking is the hardest thing a man can do. Probably the reason why so few of them do it. We often think the same thoughts. And do you know, if I had to reflect on when was the last time I had a really original thought that I hadn't had before? You know, it's, if we ask ourselves, when was the last time I had a thought that I was like, oh, wow, I've not thought of that before. Why? Because most of our thoughts are quite repetitive. It's a habit. And that inner chatter that we have keeps repeating often.
That reminds me of a song, actually. There's a song that I like, and he talks about ideas from another person's mind, and he talks about thoughts upon thoughts upon thoughts and thoughts. And sorry, it just reminded me of that song, and when you said original thoughts.
Yeah. And you can tell, do you know, when you have an original thought, if you're aware of it, you kind of think, wow.
Yeah.
And it's unfortunate people don't spend just that little bit longer thinking about that original thought.
Yeah.
Otherwise, you could actually really make progress in yourself and other people's lives.
Yeah.
So the ability to think is one of the most amazing gifts we should never stop being grateful for. And I just want to leave with you this idea. Do you know how many galaxies there are in the universe, Fatima?
I don't know how many there are.
So these are big numbers.
Yeah.
Really, really big numbers. 2 trillion.
Wow, yes.
2 trillion galaxies in the universe.
Yeah.
The Milky Way is our galaxy. It has 400 billion stars. So our galaxy has 400 billion stars, one of which is our sun.
These are numbers you can't really comprehend.
You can't comprehend.
No.
Okay? You can't comprehend. So on this small rock that we call the Earth, orbiting the sun, there is a collection of atoms, you and me, collection of atoms that has the ability to think. You and I have just had some time to think. That's amazing. Let's value it more and spend more time to think.
No, that's interesting. You and I have just had time to think because, we've allotted a certain amount of time to have conversation and not just talk to each other, but talk to ourselves during that conversation, which is really, really interesting to think about. So that is the end of today's podcast. As I said, the theme was thinking. And thank you, Dr. Khan, for being a part of it.
Thank you for having me, and I'm learning so much by doing these podcasts, so thank you, Fatima.
Thank you. So we've got 2 more podcasts, which at the moment, we're constantly thinking about how to improve our series as well. So at the moment, we will probably do one on well-being and one on physical activity. So if you would like to listen to them, then make sure you keep checking up on our website and tuning into radio. And I hope that this has been useful for you. Again, if you want to have a look at the previous podcasts that we've done on sleep and on breathing, then you can check out our previous podcasts on our YouTube channel and also on our website. Thank you.